Joseph Sidney, Family Nurse Practitioner, Hearing Technician, Ministry of Health, Wellness and Elderly Affairs. Hearing care and hearing loss were highlighted as public health concerns with the adoption of the Resolution on Prevention of Deafness and Hearing Loss during the World Health Assembly in 2017. This resolution calls upon World Health Organization and its member states to undertake advocacy through World Hearing Day on 3rd of March. The Ministry of Health, Wellness and Elderly Affairs joins the rest of the world in observing World Hearing Day 2025 under the theme Changing Mindsets. Empower yourself, make ear and hearing care a reality for all. This year's theme builds upon the 2024 focus on changing mindsets towards ear and hearing care. We invite individuals of all ages to empower themselves to ensure healthy ears and hearing for themselves and others. This campaign aims to inspire behavior change to protect hearing from loud sounds, prevent hearing loss, encourage individuals to check their hearing regularly, use hearing devices if needed, and support those living with hearing loss. World Hearing Day is the largest global awareness campaign on ear and hearing care that calls for action to address hearing loss. World Hearing Day aims to promote public health actions for ear and hearing care, stimulate intersectoral partnership for ear and hearing care, raise awareness on hearing loss and care at a national and community levels across the world, and encourage behavior change towards healthy ear and hearing care practices. World Report on Hearing Care reveals that over 1.5 billion people live with hearing loss, of which nearly 430 million people live with disabling hearing loss. It is expected that the prevalence of hearing loss will rise considerably in the coming decades due to changing population demographics, increasing exposure to risk factors such as recreational noise, as well as persistence of untreated ear conditions such as otitis media. Many of the causes that lead to hearing loss are preventable. In children, 60% of hearing loss can be prevented through public health strategies. Those who have hearing loss can greatly benefit from timely and appropriate interventions requiring a number of public health measures to include the integration of high-quality, comprehensive ear and hearing care services into universal health care system. By 2030, over 500 million people are expected to have disabling hearing loss requiring rehabilitation. Over 1 billion young people face the risk of permanent hearing loss due to prolonged exposure to loud sounds during recreational pastimes such as listening to music and video game play. In St. Lucia, ear and hearing services are provided by the Ministry of Health, Wellness and Elderly Affairs at the Entrepot and the Viewfort Wellness Centers. In 2023, a total of 943 clients were diagnosed with hearing loss, of which 63% had disabling hearing loss. In 2024, a total of 1,100 clients were seen. 704 had hearing loss, 65% of which diagnosed with disabling hearing loss, a 2% increase from 2023. How we hear in the future depends on how we care for our ears today. Many cases of hearing loss can be avoided through the adoption of safe listening and good hearing care practices. For those living with hearing loss, early identification and access to timely rehabilitation are essential to achieving their highest potential. The Ministry of Health, Wellness and Elderly Affairs, through the Community Health Hearing Unit, will focus on raising awareness on ear and hearing care throughout St. Lucia. Some activities for this year's observance include ear and hearing healthcare training for healthcare professionals, webinar on March 3rd at 6:30 p.m. targeting the population and general public, radio program to address ear and hearing care messages targeting both public and private sectors, and distribution of ear and hearing care educational materials on various platforms. The Ministry of Health, Wellness and Elderly Affairs believes that empowered individuals can drive change within themselves and in society at large. You can take steps today to ensure good hearing health throughout life. Let us all work together to make ear and hearing care a priority in 2025. Thank you.